All right, this is IPTX group like 6A. I'm Shri.
I'm Michaela.
I'm Amy.
I'm Stephanie.
I'm Sophic.
I'm August.
And we're gonna do the team presentation now. So like the first question that we wanted to answer as a team was what is like radical like belonging? And we found a few answers on the internet for this. It's more of an idea which talks about how like belonging can affect the productivity of the whole group. We did find a paper that talked about how we all do bring something pretty unique to like the workplace, and because of that, we're all also pretty much like bound by our interdependence. So as a team, we chose to have our like team definition saying that like radical belonging is to accept the lived experiences of all of the people around us and understand the like complementary like the support of the people that we need to reach the outcomes. And we also need to understand that the lives that we have are pretty much like interdependent on the actions of the people around us. And we have to learn to create expectations that are understanding of this.
The key points impacting radical belonging in healthcare teams during the COVID-19 pandemic include healthcare worker shortages due to exhaustion and compassion fatigue, stressors on healthcare workers, particularly those from Hispanic and Black communities, the impact of COVID-19 on Black, Indigenous, and people of color and healthcare workers, and the importance of developing healthcare teams that promote radical belonging. Next. Healthcare worker shortages during COVID-19 significantly impacted the healthcare system. Almost 500,000 healthcare workers retired or left their job between February 2020 to November of 2021. Those who remained faced exhaustion and compassion fatigue, which was a direct result of the decrease in staffing. With growing patient loads and less help, workers faced a higher risk of errors in patient treatment. With stay-at-home orders and school closures, the home life stressors increased as they juggled their workloads with managing virtual education for their children and primary caregiving for elderly parents and relatives. For Black and Hispanic community healthcare workers, the stakes were even higher as they faced 3.5 times the risk of contracting COVID-19 and incurred disproportionately more COVID-19 deaths than their white counterparts. Next. Black, Indigenous, and people of color were impacted significantly more by the COVID-19 pandemic with disproportionately higher mortality and morbidity rates than their white counterparts. Lack of health insurance and access to care led to healthcare disparities for these groups. They had high exposure rates due to working in essential jobs, living in larger households, and using mass transit. As most workplaces are predominantly a white majority, this has led to a lack of belonging due to increased stress and feelings of isolation for people of color. Next. In the study by Louis and others in 2022, they examined how social, academic, and democratic belonging can provide a framework for radical belonging within schools and communities. They found 3 key problems in the schools. The first issue is that schools treat academic learning and feelings of belonging separately. The second issue is the profound effects endemic racism has on students of color in schools. And lastly, school belonging focus specifically on individual rather than community experiences. Their findings demonstrate how critical it is to incorporate social, academic, and democratic belonging into our schools and communities to eliminate society's denial of belonging towards people of color. By treating each other as intellectual equals, embracing cultural and linguistic differences, and applying critical consciousness and participatory action, we can develop anti-racial learning communities that intertwine teaching and learning with a sense of belonging. Next. A sense of belonging in a healthcare team is critical to create a cohesive, supportive, responsive, collaborative, and anti-hierarchical learning community. If healthcare workers don't feel like they belong, they are less likely to communicate effectively and work productively toward the team goal of improving patient care and healthcare outcomes. Improved performance, retention, profitability, productivity, and innovation are strongly correlated with a culture of belonging and safety. Therefore, it is essential that healthcare teams create this sense of social, academic, and democratic belonging to foster a sense of radical belonging within the healthcare team.
So after reading the vignettes that were presented in the case, we came up with 4 recommendations that would help increase radical belonging in this organization. Our first organization level recommendation or intervention is to establish a paid training and education program for members of the current workforce, especially in heavily needed areas such as social work, interpreters, and nursing or nursing assistants. So reading the vignettes, a lot of the characters felt that their skills weren't used to their full potential. So if you train these employees to do more skilled work, you're increasing the amount of workers, and you're also increasing employee loyalty and sense of belonging as the organization is supporting the educational aspirations of its own employees. So specifically in the scenarios, Jonas thought he could be a medical interpreter, and Jesse's aspiration was to be a social worker. So if the organization is helping these people achieve their goals, that's beneficial to both parties. Next. Our second organization level recommendation was to construct an on-site free of cost childcare center that gave preference enrollment for the children of employees who have lower social economic status. Also reading the vignettes, a lot of characters had issues where they couldn't get to work on time because they had to take their kids to daycare, or there wasn't anyone there to take care of their kids. And this was even a huge concern during the pandemic, especially. So, if the organization is able to provide childcare to its employees, that's also going to increase employee loyalty and sense of belonging. Next. Team level recommendation we came up with was it's kind of modeled after the DAISY award that we have here at SLU, but it's to establish a monthly award system that recognizes employees who demonstrate exceptional and compassionate care. And also in the vignettes, a lot of characters were experiencing compassion fatigue due to burnout from the pandemic. But there were some employees like Jessie, who was still compassionate during this time, but she was kind of being put down by other employees for that compassion. So, if you have a system where these kind of people are recognized, that would encourage this behavior more and could also give some encouragement to those who have compassion fatigue. Next. And then on the individual level, some of the characters were having trouble doing the things that they really enjoyed, like watching movies every now and then, going on runs, things like that. And the people in the organization are individuals, and they have things that they enjoy, and that's important for their mental health and well-being. And if each individual isn't taken care of, the organization as a whole suffers. So our idea for that was to have kind of a check-in every month where you check in with your supervisor and they talk to you about, are you doing the things that you enjoy? And if you find that you're not having that time to do that, what can the team or organization do to give you that time? Whether it's like more time off or what support you need. And then you can check in again the next month. So that was our idea for that. Next.
All right, so with our recommendations, of course, we want to make sure that we are considering the All right, so with our recommendations, of course, we want to make sure that we are considering those from marginalized communities, especially those who have to utilize the healthcare system frequently. And of course, we know that in general, those people who come from lower socioeconomic status are likely going to have more health problems, more comorbidities, increased risk for mortality, etc., and therefore increased need for the healthcare system. So our ideas for working on radical belonging and creating a better work environment on all fronts for healthcare workers will hopefully in turn make it more likely for those patients who need more attention in healthcare to overall have a better healthcare experience. A example of this and yet another idea would be that there is a less chance for compassion fatigue and more likely that a healthcare worker would go above and beyond for a patient, again, who may need further attention or be using the healthcare system much more frequently than the average person. And of course, this would extend to all healthcare workers and from a ton of different backgrounds and disciplines that may care for patients of lower socioeconomic status, but especially social work, nursing, PTOT, and medical staff, such as physicians and PAs. And moving on. We must also consider folks from these marginalized communities who actually work in healthcare. And so it's often that healthcare workers who are part of marginalized communities have more than one job or may have to switch jobs frequently. And this paid training recommendation will allow them to start a new opportunity without that gap in pay. It will also allow for the possibility of stability if they are paid to train and then get good at a position, gain confidence in a position. They may not have to be jumping from job to job. And then with our childcare recommendations, we all know that shifts in healthcare are very long and can range from 10 to 12 hours. And with this as just yet another obstacle for people from those marginalized communities, specifically with relation to healthcare. And this is both in the sense of affordability as well as the long hours that they may be working at a time. And so, again, recommending that healthcare facilities implement some sort of free childcare for employees would highly benefit people from these populations. Then moving on with incentives. So incentives can provide extra support that these healthcare workers may need and allow them to earn it for themselves, which has the potential to encourage them and give them a sense of pride where support and encouragement may be lacking in their situation. So examples of this can include small pay increases, insurance premium discounts. I've seen this work actually in real life where employees may have a incentive to stop smoking or lose weight or reach step counts. And these things end up being just like a win-win overall, because then the patient is healthier, they're missing less work, which is good for the employer, and then they in turn can pay less money, as well as they are recognized and rewarded for doing a good job. And so this all, again, would come together to add to the likelihood of a job, retention, and stability for these people.
So in order to work towards reaching these solutions that these recommendations have the potential to provide, we must ensure that we focus on proper ways to implement each recommendation on the necessary levels. For our paid training and education programs recommendations, we need to ensure that we survey departments on interests and educational goals, in addition to willingness to participate in such education if it was offered. And this also includes establishing a group of skilled workers available to provide these educational opportunities in those specific fields of interests. We also want to make sure we are budgeting for increased pay or benefits or salary for the added positions following paid education and training. This includes also establishing a starting group for training and educational programs to move forward with, and following up with surveys on what can be improved for future groups going through these programs. Next. And then for our on-site free of cost childcare center, we want to again survey the department for the need of childcare services to better understand how our setup needs to proceed, which includes establishing and hiring a qualified team for the childcare center and budgeting for volunteer or paid hire status of those workers. This also includes finding a space for the childcare center on site and establishing that safe environment for the children and for the employees involved. And then moving forward to promotion to the employees of this care center and determining what enrollment is available with prioritization to children of employees that apply with lower socioeconomic status. And then also providing childcare orientation to employees and the children as they enroll to ensure a safe environment for everyone. Next. And then on the team level with the monthly award system, we want to form an anonymous submission form for each month's award recipient, and then establishing a choice of award and budgeting appropriately for that each month, which can also be surveyed by the healthcare workers to understand what kind of award would be most meaningful in that scenario, and then creating a system for feedback on their thoughts and what their suggestions are for future awards. And then also maintaining the recognition of award in group huddles and posted in the unit across all levels of healthcare workers and people to ensure that this is creating an environment where everyone can be recognized. Next. And then on the individual level, we want to establish a way to create access for wellness resources, either provided by their organization or community resources for the employees based on their goals. Whether this is something general posting or within those meetings coming up and researching with that individual, what are some resources for them? And then also establishing time for a routine break in the employees' day monthly to have this meeting is very important so that it does not get swept under the rug, and it is something that we encourage and focus on. And then encouraging employees to write down or keeping track of their goal throughout the month for discussion at next meeting, whether eventually we note that there is a need for implementing some sort of award in this process to ensure that people want to follow through on this is something that can be determined down the line. Next. And so looking at our short-term and long-term roadmap of implementing these ideas, we want to ensure that starting out in the short term, we are surveying the healthcare team to gauge participation or their ideas or suggestions for the program to make them most beneficial for those workers in that environment and across all those disciplines. And then, of course, we need the approval from administration for implementation, and then working on that upfront budgeting and financing costs for starting to implement some of these programs. Down the line, we want to continue dedicating time to maintain these programs within the healthcare team's environment and making that consistent moving forward. This includes having those check-ins and surveys with employees to figure out what is working, what isn't working, and what would you appreciate being integrated into the organization's culture, making everyone feel like they belong and included in this process as things are implemented down the line. This also includes having consistent budgeting to allow for these programs to continue, and then also assessing the impact that it has on the organizational team and individual levels down the line as well. Next. And so from the team, there is a lot of support that would be required from having participation at all levels of the healthcare team as appropriate per whatever the recommendation was. But established employees are in that position to create a new and welcoming environment focused on radical belonging and wellness that is then passed on to new hires. So just maintaining this environment and making sure that these ideas are consistently kept in the environment will definitely help with that. But then also ensuring that there's flexibility and support on an administration level in order to ensure that these recommendations can benefit the whole healthcare team and kind of dismantle that hierarchical status that may be seen. Creating consistency across managers or team leaders in implementation of this so that one floor isn't going through with it and the other isn't. And then keeping it, make sure that it's not single discipline focused, so it is across the whole healthcare team. Next.
For the metrics of success of our different levels, for the organizational level, the success of this would be the well-being of the employees and them feeling a sense of belonging and helping them achieve the goals that they want to achieve. For the team level, this would allow employees to be better interprofessional teamwork through the celebration of compassionate employees. And then for the individual level, this would increase the mental well-being of employees through wellness, through the wellness check-ins. And the employees would feel recognized by other employees and a sense of well-being. Next. And then for sustainability and scalability, The organizational level, our idea is sustainable because of the employees' happiness and well-being, which will decrease employee turnover and improve the hospital staffing shortage. For the team level, a reward system allows for sustainable employment in the hospital while also increasing the number of staff that want to work at that hospital, between the different hospitals and their staff, and the compassionate towards other employees. For the individual level, check-ins allow for sustainable relationships within the work environment, which can lead to an increase in better employee outcomes through goal setting. Next.
Our overall plan is to focus on bringing the experience and talents of all team members to provide a better and most efficient healthcare by ensuring that that the team members don't experience burnout and are also maintain good health. One of the ways that we're going to be doing this is through the free child care, planned training and education programs, and award system for exemplary teamwork and healthcare provided. Our monthly check-ins will ensure that our team members are keeping up with their wellness and ensuring that all team members are achieving their goals. Next slide, please. Throughout working on this project, we learn that efficiency of the team is crucial through delegating of work and making sure that each team member is using each other's strengths. And one of the most important is communication. But even communication pales in comparison to ensuring that everyone plays their important role for the team and that it deserves recognition. Next slide.